Hello, I am here with Rose and Dr. Osorio, and I'm Dr. Fenton Le Bon, and this is a kickoff for a program we're starting called housecalltheapp.com, Superstars of Wellness. And we have a superstar of wellness here. His name is Dr. Eduardo Osorio. He is from Barcelona. And what I'm asking everybody is, in their own words and thoughts, what is wellness for you, Dr. Osorio?
Good morning. For me, wellness is understood like a well-being of the human being, and then to prevent how the time is going on and how to feel better by yourself. And this is not only the external appearance; it's also the how you feel inside, how your cells are working on in the right way, your muscles, your joints, and then you keep in your best fit for the age you have.
You're an orthopedic surgeon, but I also know that you were trained before that as a mechanical engineer, and I found that fascinating given the fact that you were probably looking at orthopedic problems and health in a different and maybe more profound way. Could you tell us a little bit about your background as a mechanical engineer student, as how you apply that?
Yes, this is a long history, a long story about, but the relationship between the orthopedics and the mechanical engineer is because the movement of the human body is related to the mechanics, and then it's like it's the same, it's just the same. Then what we do is to try to analyze the human movement as a machine. Then the background comes from when you try to analyze how a machine is going to move, which are the main engines to move in the different axes. Then you can understand how the body is going to move and how the joints are working and how we need to keep them healthy. Then my background as a mechanical engineer, it's been related to the health world, always related to the health.
Awesome.
Your father was considered the founder of gait analysis. And when I first came and got my own gait analysis, I was probably maybe a little skeptical. But then when I saw how well it worked for my own problem, I was a believer. Can you just give a little bit of the background of your legacy and your heritage from your father starting all this?
Yes, my father was at the beginning. He was doing radiology in an orthopedic surgery hospital, and then he was seeing that some of the problems after surgery won't be solved. It wasn't solved. So then what happened? That he tried to understand why this was happening, and then he developed a gait analysis, a complete whole body gait analysis in motion. This is what we've been developing with the time, and till we arrived to this patent that we have, is called A-Nexus. This whole body gait analysis in real time in 4 dimensions. And the legacy, it's been all the knowledge about gait analysis and biomechanics comes from how to understand that the mechanical problems becomes from an alteration, a misalignment of leg, of the joint, and then most of the time an isolated surgery is not going to be the complete solution.
Well, I'm a humble psychiatrist, but I think when people ask me what your polemic is, one of the polemics is, I say, he's taught me that the orthopedic problem is oftentimes not the cause of the gait abnormality, but it's the other way around. That the gait abnormality can be the cause of the orthopedic problem. Could you just explain that a little bit better? Your expertise?
I'll try to explain it. Yes, normally you have the orthopedic problems can come by 2 main causes. One is a traumatic one, then you have an accident and there is a traumatic, and that is very clear. And the other one normally is coming due to a mechanical disorder. Then this, depending on how is this mechanical disorder, the degradation, the devastation, for example, of a cartilage, that it's going to become into an osteoarthritis. It's not a matter of age, it's a matter of mechanics. Because the charge, the weight that this joint is going to support is not well shared all around the surface. And then the mechanic is not the proper one. And the same is happening with the tendons, ligaments, and muscles. If they are not working in the right way that may mass in the axis and everything is not well aligned, then these tensions that they have are going to become into an injury.
You've always emphasized with me, with our conversations, about the importance of prevention. And you have an amazing orthopedic ecosystem in Barcelona, and you're bringing it here to Miami. And we're lucky here in the city of Miami to have such a thing coming. It'll be world-class, first of its kind in North America. And it's not only going to be focusing on surgery, but also prevention. I tell all my friends that we're going to be able to be treated like world-class athletes, not just from an orthopedic standpoint, but from a physiological standpoint, cardiovascular, pulmonary, and the whole idea of prevention. The other thing I remember always you said to me is, if you're going to a gym and you're doing significant exercise programs at 50, you may be practicing medicine without a license. So can you tell us a little bit about what you're planning on bringing here? We're ever so excited.
Yes, our project in Spain that we're already running for a long time is to customize medicine and prevention. Then what we do is try to analyze the patient, each individual patient, in order to a mechanical way, cardiopulmonary capacity, metabolism, everything. And then what we design is special programs completely customized to keep them and the right age and the right fit. Why? Because the standard programs cannot fit to everybody, because each individual body has its own metabolism, its own alterations, and then we need to analyze the whole pattern and then to customize. Prevention is really, really important. Nowadays we have tremendous technology. We have 3 Tesla, MRI, we have many things that give us a lot of messages how the body is going to be into a degradation. Before going, for example, into an osteoarthritis, we have little signals in the MRI to see bone edema, to see inflammation of the cartilage, and all these things that we can say we have the information and we need to react to this information. And therefore, what we try to do is try to see as soon as possible and prevent this degradation in the time. And it happens with all the tissues of our body.
Could you tell us a little bit about your take on stem cells? I get this question a lot. How could stem cells help me cognitively or in a mood disorder? And of course, stem cells comes into the orthopedic space a lot. Can you tell me a little bit about your thoughts of where we are now and what we should be concerned with and what we should be looking forward to, the benefits?
Yes, now we've been using for a long time, and we're using stem cells from bone marrow, adipose tissue. Now in Europe we're using monocytes also, and the results are really good. But the understanding of the stem cells as an isolated treatment is not a good approach. We need to analyze the biomechanical disorders, to stabilize the tissue with physical therapy, and then we treat at the end with stem cells. Why? Because we cannot regenerate the tissue if we don't stop or slow down the degeneration of this tissue, of this joint. And then we need to analyze it, slow down, try to stop it, and then regenerate. And the results are amazing. I think the future is going to be biological treatments. The number of surgeries, for example, replacements are going to decrease, and we more often are going to be using biological treatments. With this machine, what we do is to analyze the whole body, how it's moving in the space. Then all we do, we can measure the angles, the speed, and the degrees that we are moving in our inversion, the spine, knees, hip, ankles. With this, we can calculate the probability to have an injury. This is a highly accurate device to prevent some injuries. And also, when we have an injury, what we can do is to analyze which is a mechanical disorder that is causing this injury.
Yeah.
And this is what we mainly do. Then, this is very useful because it's not only a statical measurement, it's also a dynamical measurement. And we also could tend to running or practicing any sport gesture.
You can just do this machine at a walk, also at a run, and you can make predictive ideas of where an injury will occur, and then you can sport and focus that. Can you also talk a little bit about identifying early pathology?
Yes, for example, when you have molecular discrepancy and you're doing like this, then you are provoking a scoliotic attitude. This scoliotic attitude is what is going to give you in some years a protrusion or a discal hernia, and then we can prevent it because we can see which is the main cause of this scoliotic attitude and what's going to happen
Awesome.
before it happens.
Do you also do this in any way, or maybe think through the idea of early neurodegenerative disorders that may appear first as a gait abnormality, but its etiology is in the brain pathology?
Yes. Then the main idea of this kind of treatments that we do when we analyze this is we analyze the instability, and then what we try to give them is some stability. For example, Parkinson. The people have the immobilism trying to move, and there's not a fluid movement, and they lose. The first they do is to lose the balance, and then what we try to do is to give them balance, and then they don't need to be in that way modifying their position, and they can have a more fluid walking.
We see ever so many patients in our clinic, and the first symptoms and signs of neurodegenerative disorders are not necessarily intellectual cognitive decline, but motor disorders and gait. Early slight gait in each neurological disorder almost has its own signature gait abnormality. Could this machine be even more subtle and pick up earlier, do you believe?
I don't know if pick up earlier, but identifying an earlier stages, yes. Because one of the things we see is the flight time and the time that the foot is on earth, and then the instability they have, we can measure with 200 hertz per second, and then it's so accurate. Then if we have a normal pattern before and we're doing a follow-up, because for example, father or mother has got this kind of neurodegenerative disease, then this could be an early diagnosis or an early finding.
Of course, it's not an either or. As people age, they'll have arthritic and other orthopedic disorders combined with cognitive disorders, and this machine could tease out both of those and lead towards earlier and better treatment modalities for each specific condition, I imagine.
Yes.